Hello, my name is Justin Brennan Beers, and this is my assignment on myofascial and functional lines. To begin, we have the superficial backline, which connects the entire posterior surface of the body in two parts, from the toes to the knees, and from the knees to the brow. It's composed of the plantar surface of the toes, calcaneus, femur, hamstrings, sacrum, erector spinae, occipital ridge, and front brow ridge. The postural role is to support the body in full extension, which requires the use of a lot of slow twitch muscles, which are the endurance fibers in our muscle portions. The movement role is to create extension and hyperextension, except in knee flexion and plantar flexion. A good example of an exercise to stretch out the superficial backline is the seated reach. People who have longer limbs may have a difficult time reaching their feet, so they may have to just reach as far as possible. Next, we have the superficial front line, which connects the entire anterior portion of the body in also two parts, from the toes to the pelvis and from the pelvis to the head. It's composed of the dorsal toe phalange, tibial tuberosity, patella, quadriceps, iliac spine, rectus abdominis, fifth rib, sternal manubrium, sternocleidomastoid, and mastoid process. The primary postural role is to balance the superficial backline and also provide tensile supports for portions of the body that sit in front of the center of gravity. And the primary movement roles of the superficial front line are lumbar flexion, knee extension, and dorsiflexion. A good stretch for the superficial front line would be the upward dog. The next line we'll be talking about is the spiral line, which starts from the head, goes to the opposite shoulder, down the same side of the body, through the front of the feet, up the back, and into the back of the skull. It's composed of the ischial tuberosity, fibular head, first metatarsal base, lateral tibial condyle, iliac crest, lateral ribs, medial border of the scapula, lower cervical, and mastoid process. The postural role is to help maintain balance and determine knee tracking in walking. It creates, compensates, and maintains alignments and twists. The movement role of the spiral line is to create and mediate spirals and rotations and modulate strain and the arc system of the foot. An example is recovering from a tackle in football. It'll help you stand back up if you don't fall down. A good stretch for the spiral line is like the medicine ball toss. Line, which is a signal segment that connects from the medial and lateral parts of the foot up to the lateral sides of the body. It's composed of the first and fifth metatarsal bases, fibular head, anterior ligament of the fibula, lateral tibial condyle, iliac crest, ribs, fourth thoracic vertebrae, clavicle or manubrium, and occipital ridge. The postural role is to balance the left and right sides and mediates forces occurring on other lines while stabilizing the limbs while the upper body is in motion. The primary movement role of the lateral line is lateral bending of the neck, trunk, which I'm going to demonstrate while lying down, adduction in the hip, and foot eversion and inversion. A good stretch for the lateral line is the lateral bend, which I'm probably out of view for. But if it's too difficult to do while standing up and doing to the side, it's also possible to do laying down. We have the front and back functional lines, whose purpose is to extend the arm lines across the trunk to contralateral pelvis and leg. One line runs across the front and one line runs across the back. Their functional role is less involved in standing, however they have strong stabilizing abilities, and they're unique in the fact that they involve superficial tissues that are used so much that they rarely have time to relax in day-to-day activities. The back functional line begins at the distal attachment of the latissimus dorsi, runs down into the superficial luminae, passing through the sacral fascia to connect with sacrotuberal fibers of the gluteus maximus on the opposite side. The front functional line is distally attached to the pec major on a humerus, passing along the abdominal aponeurosis that links external oblique fascia to the pubis.